Right, now it's time for Data Point, and tonight we're focusing on the Community Health Promoters, the program that is expected to be unveiled by President William Ruto on the 20th of October 2023, which will be on the Mashujaa Day. Let's just take a look at what that entails. Already we know that the national plan is that to have 100,000 community health promoters, CHPs in short, and those will be responsible. One promoter will be responsible for 100 homes within their vicinity or their locality. And of course, they have so far been given the kits, the CHP kits that have been distributed from Nairobi to the rest of the country through the county governments. So far, their understanding is that the government of Kenya, that is the national government, will be providing stipends of up to 2,500 shillings per month per person that will be involved in that program. And the counties are expected to give a minimum of the same, 2,500. There are certain concerns, but we'll be looking at that later on. If you have to calculate, then it comes to about 500 million shillings per month for both the national government and the county government. Now, in a year, that would be 6 billion shillings shared between the two levels of government. Now, they are, like I said, they have received, or they will be receiving, at least for Nairobi, they have already received these kits. And these are the items. In total, there are 42 items in those kits, including a first aid kit that has several items. Then they'll be having a digital thermometer. They'll also have a glucometer, which you have, this obviously is for checking the sugar levels in the blood. They'll have a pen for doing that work of pinching the finger. They'll have the blood lancet, the exact gadget that will be used to pinch, and also auto prick rather. And then they have the test strips, 50 of them at a time. Once they finish, then they can go and refill to the nearest health facility. They'll have a blood pressure monitoring machine, a weighing scale, and medicine box that will have assorted medicine for different issues, including zinc sulfate, which will be in a position to help maintain the immunity of the patients, but also helps very much when it comes to patients that are struggling with diarrhea. Povidone iodine solution will be very necessary for cleaning infected wounds, but also they'll be receiving paracetamol, both a tablet and syrup, syrup for the children, tablet for the adults, for relieving pain, but also dealing with fever issues. Albendazole will also be in form of a tablet or a syrup, which is a dewormer. The syrup will be given to the children, the tablet for the adults. Then also there will be antacid tablets to deal with hyperacidity, as well as chlorine clear water tablets that will be used to treat water, especially for drinking. And then oral rehydration salts, or ORS if you like, will be used especially for the children that will be suffering from diarrhea, to also work with the zinc sulfate. Now, this is how the distribution looks like based on the conversations we've had with some of the county governments. For instance, in Nairobi, they say they have 7,480 community health promoters. They are receiving 3,500 shillings. Of course, the 500 shillings is going to NHIF contribution, and they have budgeted for 314 million shillings to go into that. Tharaka Nithi says they have 1,267 promoters. They are paying them 3,500 shillings. Of course, the 500 shillings is for NHIF contribution, and in total that becomes 53.2 million shillings for Tharaka Nithi County. Kisii County talks about 2,900 CHPs, currently volunteers. They are receiving 2,000 shillings, but then the 500 shillings goes to NHIF contribution, in total 87 million shillings. Kiambu County says they have 3,214. They need more, but so far they have this, at a rate of 2,500, coming to 96.4 million shillings in a year. There are counties like Nandi and Meru. They have, yes, community health volunteers, but they pay them nothing, apart from sometimes occasional allowances for airtime or transport, but it's not in a consistent format. Then for Kirinyaga County, they are saying that they'll be getting 2,000 community health promoters, and they'll be being paid 2,500. That's a budget of about 60 million shillings in a year. But there's a schedule that has been shared by the government in as far as the distribution of those kits that I just described, with 42 items. For instance, Kiambu is saying that they have been allocated some 3,070 kits. Of course, the stipend by government would come to 92.1 million shillings if you had to consider that figure. But also Laikipia, they are receiving 1,153 kits. Nyeri County, 2,563 kits. And Mombasa, 2,282 kits. And if the government is going to distribute the stipends based on the number of kits, then these are the amounts that each county will be receiving for that. Then what else do we need to take care of? Kilifi County receiving 3,650 kits. If you have to calculate based on that, then the stipend from the government of Kenya at the national level will be 109 million shillings. Samburu 973, Homa Bay 2,860, and Garissa 2,006. So those kits each per community health promoter. The qualifications for the CHPs are as follows. You just need to be literate, meaning you can read and write, but also need to be community oriented. That is, you reside in that community. You will be trained in a manner that is going to be continuous. Already some counties have done this training, some have been doing it, for instance Tharaka Nithi and Nairobi, and you'll be attached to a health facility, a community health facility within your area of coverage. Now, continued here is that they are all receiving smartphones. These are CHP properly specially designed CHP smartphones. They're just expected to be in a position to use them for this purpose, not for anything else. The phones have been locked to that, but also the community health information system is what has been installed in those phones, meaning that they can be monitored at any given time, especially from the health facility that they are reporting to. And of course, they are Safaricom supported. Now, the scope of service is as follows. They'll be involved in promotive and preventive services in their areas. They will promote early detection, and that is why they have those kits, especially to check on the glucose levels in the blood, but also the blood pressure. They'll also be involved in community sensitization, provided they have information, and also they'll be visiting older persons and pregnant women the more, especially because of the conditions that they are in. Now, some of the contentious issues that have been raised by different stakeholders, including the counties, that the Council of Governors has not taken a position on the county stipend. They're expected to meet sometime next week to iron that out. The funding of additional budgets, because obviously because of this program, then some counties like Meru that have not been spending anything on that, they have to create a budget for that. The number of CHPs per county, remember I've just indicated the kits that have been distributed. Some counties need more, others are planning for less. Then the Government of Kenya funding of 2,500 shillings. Will it be 2,500 or are they going to match? Remember, Tharaka Nithi is paying 3,500. Will the Government of Kenya match the 3,500 or are they going to just pay 2,500? And what happens to that difference across the counties? And of course, NHF contributions will be coming to be a factor, especially knowing that already there's a conversation to reduce the minimum contribution to 300 shillings. In the case of Kiambu, which is a good point to reflect what you're talking about, Kiambu currently have 3,214 CHPs or community health volunteers at the moment. The government of Kenya has distributed 3,070 kits. It's slightly lower than what they have, but they are saying that Kiambu demand is 5,125. Obviously, based on these calculations, of course, at the moment, Kiambu is spending 96.4 million shillings. Based on the kits, they would receive 92.1 million shillings, very different from this. And of course, if they are to go with the 5,125, then the total budget between the county government and the government of Kenya at the national level would be 307.5 million shillings. And that is considering that each CHP would receive some 5,000 shillings every month. And that is a data point tonight. Of course, you continue to monitor what happens, knowing that the promise is to launch this program on the 20th of October, which is next month. That's Data Point.